Welcome to In Focus on ABC 10. I'm Trent Bailey. Most Upers proudly live in small towns, but how are these small towns coping with the COVID-19 crisis? I had a conversation recently with Ishpeming City Council members Lindsay and Jason Chapman to find out the state of the city during the pandemic. Here is that conversation. Enjoy.
A first question that it's going to be pretty broad here, and you guys can each take turns answering this. You're both on the city commission. What would you say is right now the state of the city? Things have been there's been a wrench thrown in plans, I'm sure, and different things that is going on around the city. There's a new manager who got here just in time for everything to get shut down. So I'm sure there's some difficulties there. Do you guys just want to talk about the state of the city and where everything's at right now?
Sure. I guess, I think we're probably where a lot of small cities are right now, right? We're sort of just learning how to accommodate the changes and to navigate those and trying to adapt our plans just as anyone else is. But I'm not sure that we know just yet what the full impact of this will be on the city. I'm sure that there will be financial ramifications, from various different angles, but I don't know that we really know the scope of those yet. And so we're still sort of in this, reacting or responding to the state's orders and kind of just moving forward, kind of similar to how anyone else is.
Yeah, and I would agree with Lindsay. I think we are doing the right things right now as a community. I think our community has come together also just to support each other. And I think Craig has been doing a fantastic job working with different agencies, that are above the city, whether it's the county or it's the state. And I think as we move forward throughout this process, I think we're going to see that we are going to have to look at our budget and say, okay, what can we cut? What can we do that won't affect the lives of the citizens in the community or the employees? And it's going to take some creative strategies, but I think we have a dedicated council that will truly look at where we can cut without affecting people.
I would add to that Craig has been in the position of city manager for a relatively short period of time, and he I think was not even quite settled when all of this really took off, but I think he's been doing a fantastic job of responding to it. And what I had seen of what he was doing prior to this leads me to believe that we got him in place just in time. And I'm very comfortable with the job that he's been doing so far, very supportive of the job that he's been doing so far. And I can't imagine having tried to navigate this without a city manager. So in addition to, thinking that he's doing a good job, I'm extremely appreciative of the fact that the council was able to make this decision, move forward, and that we got him off to a good start before, all this stuff happened. So.
Yeah, and that's kind of an important thing there is that, and you guys both kind of touched on this, that there is going to be economic impact or funding impacted by what's going on right now, especially without having a city manager in place. It would seem kind of rudderless on where you're going and direction.
It's been a nightmare.
But I mean, now that you have a city manager, there were some concerns about the financial standing of the city before all this happened, and now even with less funding that's going to be coming in the future, how do you think the commission and the manager will be working together to help keep the city kind of steered on course here?
Well, I think if you looked at the financials, if you looked at the budget and you looked at it at face value the last couple of years, the first time I looked at it, I was like, oh my gosh, we're projected into, to like a $200,000 deficit this year. And that seemed really scary at the onset of it. However, last year after we had I think it was Anderson and Chapman came in and did an audit for us, And then in June, they came and gave a report on our 2018 financials. And they actually said we were in a pretty good position. So Jim Lampman, our finance director, is extremely conservative in his budget projections for the year. And so he does, it's pretty much worst case scenario on everything. Of course, this is worst case scenario. So who knows how it is going to play out now, but at least with his 2020 projections, you can look at that worst case scenario and say, oh my gosh, that's really bad. $200,000 into the general fund or whatever. But the general fund, is not in bad shape. And when they did the audit last year, you could see that we really had been on a pretty good upward trajectory from where the city had been, I want to say close to 10 years ago. We really were in bad financial shape, and we've really over the past several years climbed out of that. Could we be in a better position? Absolutely. Could the city have more money? Could we be doing more things? Absolutely. But it's not, if you look at it at face value, it can look dire, but it really isn't. We're in a good position. And as I said, the things that I've seen Craig talk about and the moves that he made pretty quickly on creative ways that he was already able to find funding and find money for things. I think we're in a good position to respond to this.
I do too. We looked at the budget this cycle and it looked bad, but when you really got into it and you listened to Anderson Tackman and you listened to Jim, it's exactly what Lindsay said. We were looking at worst case scenario on paper, and now I guess we can really throw that out the window too, but we're still in a position to where our community is going to be stable and it's going to be functioning. And obviously our number one goal is to look at this cycle and say, okay, we are going to have to look at what we can do. Let's figure out what we can do that won't cut services to the community and won't cut the wages and cut hours and cut employees, because we really need to look at this as people and how it impacts other people in our community rather than dollars and cents. And that's something that I'm always going to look at, because the people of our community are our number one asset, and our employees are our number one asset. They're people. So what we can do is just take a look at it, take an honest look, see where we're going to be with revenue sharing by the end of this fiscal year, and just kind of go from there and prep.
I would also add that we, because Ishpeming is a small city, we've got a fairly diverse economic base as far as the types of businesses that are here, where people work, so forth. Other places, and I don't necessarily mean to compare to Marquette or, I guess I grew up outside of Traverse City. Traverse City canceled the Cherry Festival. Marquette has canceled a number of larger events. I mean, we have and may as well, but our events are not as large, and they're not as large of a percentage of the economics that happens within the city. Will they hurt? Will those closures hurt? Yes. But they're not going to have the gigantic economic ripple effect that some of the others will. So I think that, the diversity of the economy in Ishpeming is such that, it's going to hurt. I'm not going to lie, but it's not going to be as detrimental as it might be in other areas. So I think we're well poised to bounce back from this, or to have it not create as big of a dent as it might otherwise.
You brought up something there about the types of places that people are working, and Ishpeming has had, there's several businesses and restaurants that are still open and thriving and stuff. There are some other businesses that have had to close their doors at this point and remain closed right now. Is there anything, I know there's definitely federal aid that's been able to help and statewide aid that's been able to help some of these businesses. Is there something from a city standpoint that is is available for these businesses that would help them once they are able to reopen their doors, or help them get to that point to reopen the doors?
Yeah,
Go ahead, Jason.
I think the one thing that I would recommend is that our DDA, which I'm the council representative on, is that the DDA is probably going to have to take a look at rebooting a little bit in ways to kind of help our downtown advertise and to promote our downtown in a manner that's responsible. I think we have to just look at, again, we have to look at these businesses that they're people that are who own these businesses. So we have to try and figure out the best way to help them. And if that's working with them, with their legislators and that to get aid, I think that's our best avenue right now in promoting it, their businesses as a community.
Yeah, one of the things that I think that they can do too, it's not so much that the city can help with this in particular. I mean, there's promotion that, like the DDA can do and so forth, but I think that this really is the time for businesses to consider their online presence. I've worked with the Chamber of Commerce in the past. We've run workshops on websites and social media, and a lot of Ishpeming businesses have upped their game on social media and websites. And I think if you're a business and you're feeling the pinch, and maybe if you aren't even feeling the pinch just yet, this is the time to embrace social media, websites. There are a lot of resources for that right now as well. I know that, I'm blanking on the name, Invent at NMU is offering free assistance with a lot of that stuff right now. I'm not quite sure what the process is on that, but almost any of those organizations are helping with that. And I think that, getting in touch with the Chamber of Commerce as well. The Chamber of Commerce has been doing some putting together lists of businesses that are still open and so forth. And they are a member-based organization, so I know that they are trying to do their best to help all businesses, but they also have to provide that assistance for their members. So if you can help support that organization, join, and then that really helps everybody. But I think online presence, social media, and website combined, if you're a restaurant and your menu isn't available online, you got to get it online. If you're a restaurant and you can make ordering online happen, you should make that happen. If you're a small store and you can make shop online happen, whatever you can do to get it online, do it now.
Yeah, and backing up what Lindsay said on that, we've seen the community rally around these restaurants and around these businesses that that are open right now. I like what I see from the Venice all the time on the inside of their pizza boxes. They're writing, little notes to the people who are supporting them. The Congress is open. All of these places, Bucks, everything is open. Jasper Ridge. We just need to continue as residents of the city to support these businesses too right now. And one of the big things that I've been kind of pushing is, buy a gift certificate or a gift card from these businesses right now too, and use it later or give it as a Christmas gift. Like, that's how far we should be planning out right now to help these small businesses as community members, because we hope that, everything is going to be open soon. So let these businesses get this extra revenue right now from people. And then when they're up and running, that's when the gift card gets used and it doesn't impact them, as much. So I just think there are a lot of creative ways that we can also help them too.
Something that Ishpeming has that not a lot of small cities have is its own hospital. And Bell Hospital right away was very quick to, limit the number of people that were going in and out, and they're doing screenings at the doors for people that are going in there. How important is that for a city like Ishpeming to have its own hospital in a time like this, and especially to be taking the right steps to make sure that things aren't really getting out of hand?
It is absolutely critical for our community to have Bell Hospital here. rural access hospitals are so important across the entire Upper Peninsula, but for us to have one here in Ishpeming, it's essential. We don't have to travel, 15, 20 minutes for our healthcare when we can go to Bell. And I talked to one of the physician's assistants who set up Teal Lake Medical for the testing site. They have been doing an excellent job as a hospital system here in Ishpeming. So I can't say enough about good things about Bell Hospital and the staff, the nurses, the support staff. They're doing an excellent job, and they're doing it very quietly, but they're getting it done. And they're the heroes in our community. That they don't wear capes; they're wearing scrubs. So I just want to thank all of them.
Yeah, I would echo everything that Jason just said, and I think that they've been extremely well prepared, having talked to some of the staff there as well about their response to this and about setting up Teal Lake as the testing site. I think that they've been extremely well prepared, but fairly quiet about it. Just, getting ready and just being there should this really blow up in our community.
You guys both brought in the Teal Lake testing spot there at the Teal Lake Medical Facility there. How valuable do you think that is for a small community like this, that there is that testing site that also will go hand in hand with Bell and the medical care that is in this community?
Well, I think it's invaluable. We don't have to travel very far. If we were to have cases go up in Ishpeming or on this side of the county, even if the county were to blow up, Marquette would probably, that's where most of the cases are right now. So there might be some fear about traveling to Marquette or traveling. I've heard already just some apprehension about going to the hospital for testing. So if you can come here where it's smaller and there's potentially less exposure, I think that makes people more comfortable. And the other thing I was going to add before was that Bell has done a really good job of updating on social media. So their posts have been timely and informative. And I just feel like they've done a good job of just sort of quietly being very well prepared and doing what they need to do. And that's a fantastic asset in our community.
Yeah, and if you look at how they set it up, it's an in and out process at Teal Lake. It's, you're not, crisscrossing, with other people. It's to the point. You get in and out fast. I've had some telemed appointments in the last month, and those have went over smoothly. And just they've been doing a really good job with even staying on a schedule, and I believe they're starting to take more in-person appointments too now, which is excellent. And
is there anything you guys want to say about the state of the city, what's going to happen going forward, anything like that as we kind of progress through this crisis here together?
I guess I would just want to remind people that, social distancing is important. I think a lot of people have come to the realization that this isn't really going to go away, right? It's not like next week the coronavirus is just going to disappear and we'll all just go back to normal. As great as that would be, it's just not going to happen. And so I think that the more we can do to, sort of remember that okay, we can't quite let our guard down. If we're going out to the park, we need to be vigilant about social distancing. The weather's going to be warmer. People are going to gravitate towards each other. Oh, I haven't seen this person in a long time. And we're going to have to find what kind of our new normal looks like with that, because people are going to socialize. So it's a matter of, making sure that we maintain the distance, wearing a mask or some sort of face covering. I know there's been a lot of backlash about face coverings in some areas. And, it's not that the government is telling you to wear a face covering. It's that I wear a face covering so that if I have the illness, I'm not giving it to you. That it's a I care about you gesture. And I think that the more that we can get people to do that and to respect the social distancing, the easier it will be, for everybody. And, when I go out and about, some places are more vigilant about it than others. And I would just encourage everyone to be vigilant about it, because it really is, it's a care issue. I'm taking responsibility because I care about other people.
Yeah, and I'd like to add, I was on a Zoom conference last week with Lieutenant Governor, and I was able to ask Lieutenant Governor Gilchrist some questions just about, where we're going to be going here in the next couple weeks and couple months, and it echoes what Lindsay says, is that we are in a new normal right now, and eventually things are going to reopen, and we're going to have to go on as a society, but coronavirus is still going to be there. The flu is still there, even though coronavirus is much more deadly. We just have to remember to cover our face. We have to remember to wash our hands and have hand sanitizer. And we have to remember that our mental health, we have to take care of our mental health too. I have to get the conversation going a little bit more in our community about mental health. And May is Mental Health Awareness Month. So, talk to people, you can get free Zoom accounts for 40-minute meetings. So, get on there and talk with your kids or your grandkids or your friends, have a, cocktail hour, or, sit down and eat dinner with your friend or your family virtually. It's a new normal. So for me, I want to promote, positive mental health. If you do need to seek help, talk to somebody, and don't be afraid, end the stigma. I'd be remiss if I didn't also thank all the public health officials out there who have been doing such an amazing job, our police officers, our firefighters, all of our frontline workers at our grocery stores, our gas stations, our pharmacies, everywhere. And, we've got people who have went back to work because they're needed, and as nurses, they're needed. We all heard the governor mention Linda from Gladstone. Well, that Linda is a very close personal friend and mentor of mine, Linda Romps. And, she went back to work at Norlight Nursing Home. We're just seeing Yoopers just come together. We're seeing communities come together. And I couldn't be more proud of the way, our communities are coming together and supporting our small businesses. And as a Bell baby, I'm there to support our nurses and our CNAs, our support staff, our doctors in any way I can. They can contact me, and I'll answer any questions that the community has too. So.
All right. Well, I appreciate you both taking some time to talk to me today. It was really good. I think there's a lot in this that people around the city of Ishpeming and outside of Ishpeming that may want to, know what's going on here, that they'll get a lot out of this. So I really appreciate both of you guys taking the time to talk to me today.
Yeah, you're welcome.
Thank you.
All right. Thank you.
Mm-hmm.
I'd like to once again thank Ishpeming City Council members Jason Chapman and Lindsay Bean for joining me and talking about the city. And I'd like to thank all of you for watching In Focus here on ABC 10. You can watch the full episode on our website at abc10up.com. Stay safe and have a good afternoon.